Ted Drabrowski, thanks for joining us again on the Illinois channel. And we are again going to be talking about the coronavirus and what it's been doing to the Illinois economy and the national economy. Every day, the Illinois channel has been covering the governor's press conferences that he has at 2:30. We've been carrying those live, and we put them up also on our YouTube channel. And they've been getting a lot of plays. One of them actually got over 12,000 plays. But by the same token, there's information that we are not getting, and that's what we wanted to talk to you about. And the real question that is now coming about is, when can we reopen the economy, and based on what information? And Ted, I will tell you, just as we are beginning this recording on Monday, April 13th, France just announced that it is going to be extending their nationwide lockdown to May 11. I hear the mayor of LA is talking about keeping his city locked down until maybe sometime in the middle of summer. And lastly, President Trump, who is eager to get the economy reopened, is talking about maybe overriding the governors and the mayors if he in fact has that power. So with that as a setup, let's get into, you are looking at data that often we don't hear about. So give us your input on when you think we can, and by what methods, reopen this economy.
Well, Terry, I don't know when that is. What I can tell you is what we don't know from Governor Pritzker and for the likes of Lori Lightfoot. We're not getting the right information and the right data to understand how those choices might be made by the governor, in particular if he wants to extend the lockdown. Today, we're getting very little information from Illinois, from the government. We compared the information we get from New York and other states, and there's a lot more information that gives us guidance about how things are going with regard to hospitalization rates, the resource data that's available. Governor Pritzker refuses to make that stuff public, and so President Trump, Governor Pritzker, other governors across the country are going to make some of the biggest decisions they've ever made in their lives, decisions about whether people are going to live or die, what's going to happen to the economy. And with such big decisions that are going to be made, we need great information for the public. The public needs to understand if there's any kind of extended lockdown, you can bet the public needs to know how that decision was reached, what data was used, what are the models. That should all be very transparent. There should be vigorous debate about all that information. And today, we see no signs of that. Governor Pritzker continues to duck questions about his models and his data.
Well, one of the things the governor, you mentioned the models, and both at the national level and at the state level, and I don't know that the state is really any different. The models were telling people that we were going to have maybe as many nationwide as over 2 million people dying. More recently, they indicated that, no, maybe it would be between 100,000 and 200,000, with the peak coming right about now, right about in the middle of April. In fact, now we keep seeing a lowering of those, maybe in part because we've been staying at home. But it looks like the total deaths from the coronavirus could be maybe only in the area of somewhere between 60 and 80,000. And even that number is somewhat suspect, because there are apparently people being doctors being told to count everything as a coronavirus death, even if it was only somewhat of a contributing factor to other underlying disease. Let me, Ted, of course, as we have been hearing from the governor and others, the governor often saying we don't have enough ventilators, we don't have enough hospitals beds. We want government to stand up and respond to crises. So we're not criticizing the governor or the president for that matter. He sent a boat up to New York. Here is what the governor and the mayor of Chicago worked on with federal help at McCormick Place. And we can see we have all these beds and bedrooms that were made for hospital rooms that were created. But with that in mind, Ted, let's go to what are some of your points and data that you think we should be looking at?
Well, so we at WirePoints and my colleague Mark Glennon did a great job of pushing for more data from the governor. ProPublica had said that places like Illinois weren't publishing the hospitalization data and the resource data. And so we started asking for it. And finally, on April 3rd, the governor started to release some information on hospitalization, and ICU beds, ventilators, things like that. But he won't make it public. So we have to write every day to ask for it. We finally get it. And so today at Wire Points, we started publishing that information daily. They won't publish it, so we will. And
well, let's look real quick. Here's hospitalizations. We just saw those hospital beds. Here's hospitalizations. What can you tell us? What should we take from this that you think is significant?
Well, the country and many places in the state keep talking about cases, and cases don't really mean much, because cases don't tell us whether that means people who are sick and need hospitalization or are at risk versus those who don't even show symptoms. And so really what we need are what's happening in the hospitals. Are hospital beds full? Are we getting more and more admissions? That's the kind of stuff that we need to know. And so finally, this data is being provided, but not publicly. So what we're seeing today in this data is that perhaps we're starting to see hospitalization rates start to peak and flatten. And that would, of course, would be really good news if, in fact, we're starting to see a flattening. And that's what the models have predicted that maybe we've already peaked. And so the good news might be is that we have the worst behind us, at least in this phase.
Let's also,
but this is stuff that should be public.
Yeah, let's also, the governor was very critical of the president on a number of areas, talking about not having enough ventilators to respond. Here is the count on ventilators. And the one thing I would point out to the viewers, if you look at the dark number in these green bars, the darker green is an indication of how many of the ventilators are actually in use and how many ventilators the state has over this last 2 weeks.
Yeah, so this is a case where Governor Pritzker just berated the federal government over and over again for not getting ventilators. He wanted an order of 4,000 more ventilators. Well, it turns out we're just either hitting peak or just past our peak need, and we have right now almost 60% of our ventilators free, available. So, and if you looked at the ICU beds, you'd find that 30% are available. If you looked at our hospital beds,
here's the ICU beds. Let's just talk about that.
Yeah, so we have about 30% of our ICU beds available, and if you look at the overall hospital beds, we have about 40% available. So the capacity issue that Governor Pritzker made a lot of big deals about were perhaps, well, who knows? I can't tell whether it's politics. Showing you, he has not made public. It's only because we're making it public. He will provide it to people who write and request it, but he refuses to publish it daily, which is why we're doing that.
Another factor is who is dying. We hear these deaths every day, and of course, it's always a tragedy. But let's look at the numbers, the breakdown of that by age groups, and what we see here is that. The people in their 20s, there were only 3 people in the state of Illinois who died in their 20s. When you look to the right, there you see in the red, these bar graphs, it works out, as the headline says, 84% of those who have died from this virus are the age of 60 years old or older. Right?
That's correct, Terry. And this information is very important because it lets you know who's at risk. But it also what it lets you know is who is not at risk, and you can see that the younger you are, the less at risk you are. And I think there's a lot of fear now because this isn't published very properly. Again, this is some of the data that is out there, but here's what's missing from this data: 90% of the people on this chart had some other underlying causes, whether it be diabetes or some kind of heart disease, some other underlying cause, which is why they passed away. 90%. So that means even some of the younger people who passed away, it wasn't because they were young and healthy. Although you'll find some, but the majority of these people who die have an underlying cause. So it's not that everybody needs to be fearful of dying. Of course, we need to be fearful of giving the virus to somebody else who might. But we need to understand that these, now that we have this data and these numbers, we need to use it in a smart way, so that we can finally open up our economy sometime soon.
Do you have any suggestions?
Well, I think here's the issue. Governor Pritzker and President Trump, they have the tough decision to make. They're the ones making the call with executive orders in the case of states. And if Governor Pritzker is going to continue to keep the economy closed and keep the stay-at-home orders in place, we have to be cognizant of the fact, and we'd like to see his numbers on, what's the impact of that on the economy, and two, the people in the economy. We could have more opioid deaths. We could have more suicides. We'll certainly have more mental health issues. We'll have domestic violence. We're going to have much more poverty. So all these things need to be weighed in a model of some kind and looking at the risks of the virus versus the risks of the economy. And Governor Pritzker, he keeps being asked, but he keeps rejecting he will not share what models he's using and how he's using them to make these decisions. And, it shouldn't be one of those things, hey, trust us, right? Like, we want to trust our government, but we also want to know what the facts are. We want it to be transparent. And we want there to be really vigorous debate about the issue on both sides, both from a health side and from an economy side.
Well, and obviously everything, not everything, but a lot of the economy is at a standstill, including state government. We have the legislature that's not meeting. They have to get back together at some point and pass a budget. The fiscal year starts July 1. So all the various benefits going to everyone who gets tax dollars, whether it's the universities or students needing grants or hospitals, that we need a budget. And that's one thing. Then obviously you have other people who have built their entire career about building a business, and maybe it's a successful restaurant business. But, restaurants and small businesses are a little bit like trying to hold your breath underwater. If you're closed for too long, you can only last for so long without having more business come in the door. So some of these businesses, the president and the business leaders would argue, are not going to be in business if we keep the economy closed down too long. So that's also the clock is ticking on that as well.
Well, Terry, that's the bottom line is that, there's projections, as we talked about before, of up to 30% unemployment. That would be about 2 million Illinoisans out of work. And you can imagine what that means. You're talking about poverty. You're talking about people struggling just to make ends meet. You have people who live from paycheck to paycheck, and now they don't have one. It could be a disaster. And I think what people are not understanding is that the disaster of an economic depression could far, far exceed, especially with what we know now about the virus, it could far exceed the deaths from the virus. And so what we want to call on is Governor Pritzker to become transparent, to share his data, to share his models, and to make his case to the Illinois public. Because if not, I think you're going to have a lot of resentment from the public.
Yeah. How do we make someone whole? Now, what do you say to those, and whether the governor makes it? Other people, the criticism is going to be that you're putting dollars ahead of lives, that you're saying the economy is more important than saving lives. And even if it is 84% of the people over the age of 60, we don't want to be killing moms and dads and grandparents.
No, the key, Terry, is knowing who's at risk and then protecting the heck out of those people, right? We know that it's the elderly people. We know that it's the people who are coming in contact, probably the younger crowd. It might be a South Side mother or grandmother who lives in a multi-generational home. We need to help those people, and they're the ones who need to be protected. So yeah, absolutely, we need to do that. And the other good news is that we've had a chance to build our resources in the hospitals, right? We have capacity now. We have the McCormick Place. So there's a lot of capacity. We have to keep building it and be prepared so that when we open the economy, we don't get hit. But at the same time, it's not about the economy only, although the economy is massively important. It's also about civil liberties, and it's also about the lives. There are many, many lives that could be lost or will be lost under an economic depression. We've seen that in the past. Suicides go up. We know we have the opioid problem for people who are unemployed. We know we have poverty. Poverty is also horrible for health. So it's health versus health. We just got to be smart about how we do it.
I've not heard this argument made before, but there is a takings clause in the Constitution. And if someone had $1 million business, and because the government shuts them down and now they have no business, you just cost them not only $1 million, you cost them their life's work. They might be 65 years old. They can't start over. Rebuilding a business over a period of 10 or 20 more years. They don't have that. So then the other aspect is they could, seems to me, have a very good case for suing because it was the government that caused them, not an act of God, to be driven out of business because you refused to reopen the economy when maybe you could have done so in a way that allowed them to at least survive, if not thrive. If we said, if you go into a business, maybe you only allow people under the age of 60 to go in. Maybe you allow people 55 and older, if they're workers, to work from home. Maybe you require people going into different places to wear a mask, but at least they could still be doing
smart
commerce.
about it.
Yeah.
Yeah, we have to be smart about it.
I guess the thing we're saying, isn't there
all that.
some middle ground here? And then let me go ahead and respond. Do you have any, have you given any thought to the strategies other than the need to reopen the economy? What is some of that middle ground?
No, I think you're right. I mean, we have to be smart, right? You know, we're dealing with a virus, but we know a lot more about it. We know that social distancing is going to have certainly a major impact on it. So we're not going to throw away what we've already learned and the practices that we've proven are helpful. But by the same token, you know, a lot of the public was willing to put up with a stay-at-home order and an economic shutdown because there was huge fear. There's huge fear, and so people put up with it. But you know, if it continues for much longer, like you say, people are going to challenge it, whether it's a legal challenge or just people start going out more, and then you've got the risk of arrests, you've got the risk of all that, and so it really behooves the government, whether it's Pritzker or Lightfoot or President Trump, it behooves all of them to be really transparent and to make their case to the public, because the public's going to want to hear it. If not, we're going to have people on the streets and we'll just keep having a mess. I
think one can understand that maybe we don't want to open up the baseball stadiums just yet. Maybe we don't want to open up the movie theaters or the live stage productions just yet, where everyone's sitting. But you know, even in some of those venues, I suppose we could say if you have a 300 seating capacity, you know, maybe we could have it like we see at the White House briefing, where we say you let 100 people in and you don't sit next to each other. You have 3 seats between you. It seems to me it's somewhat of a will. How much willpower is there and desire to make opening the economy a priority, and then working to see how can we achieve that in a safe way, and not have these hyperbole of these questions. You know, are you putting a dollar ahead of grandma's life? I don't think that's really a fair choice.
No, Terry, I think you're right. You know, don't forget, we'll soon have more testing. We'll have hopefully some of these serums ready. So there's going to be a lot more to help us open up. But I think in the meantime, what we have to do is we have to balance the data, and we need the data. And if in fact, you know, we have so much more capacity that we saw from the state's numbers that again, the government won't publish publicly. If that's true, if our hospitalizations are flattening, if our death rate's going down, all those things are very positive. And but we need that information. And bottom line is, without the data and without transparency, I think the public's not going to be happy, and so it behooves our leaders to really be transparent and open with their models and their data.
Ted, I hope the people appreciate the fact that we are just trying to cover all sides of this issue, and that we do need to have the economy. I had someone on Facebook say, after April 30th, I'm done, and I think they meant done in terms of going along. You know, that the public has been very good by accommodating those in government and following their orders and staying at home. At a certain point, I think the nation's patience is going to wear out. So I think for those in government, while I don't assign any political malcontent discussion here, I think the governor and the president and the mayor are all probably well-meaning. And they want to save lives, and they've done a good job in many ways of being good advocates for getting PPE, of expanding at McCormick Place and other things they've done. So we're not criticizing, but I think we are trying to say we do all have to be cognizant, those in government, those of us staying at home, that we have to get this economy going again. We just don't have the wherewithal to sit at home and let the underpinnings of our economy rot to where then we can no longer open it because so many of our businesses have collapsed.
That's right, Terry. That's the big concern. And you know, when you hear potentially 2 million Illinoisans, right, out of 12.7 million population, that would be destructive. And we're talking about 50 million Americans unemployed if that same number plays out at the national level. The toll from that would be phenomenal. So we got to be really smart. And as you say, if we let our economy rot in some kind of way, it's going to be really hard to reopen in a successful way. It won't be that V-shaped immediate recovery. It'll be one that takes a long time and with a lot of pain and a lot of suffering.
The one other thing I would say that you and I have discussed already in a previous interview is this is costing the state of Illinois billions of dollars in tax revenues and the city of Chicago, and neither of those political units have financial stability even before this came along. So if we're going to also save the benefits of pensions and all the other things that we want government to do, teaching our kids, having, all that the government does, we need to get the government having tax revenues from a functioning economy, because otherwise it's also going to come to a grinding halt as far as paying our fire, police, and all the rest that government does.
That's right, Terry. The government, we count on core services, and that's public safety is a huge one. Their pension plans are broke. You talk about the core services of taking care of the poor and the needy. The government can't function on that either. So it's a real mess. And what we need is a growing economy for Chicago, for Illinois, for all of our cities across the state. I mean, if you look at a lot of the cities across the state, they are going to be struggling in a bigger way. The bailout money that's coming might have a hard time getting there because a lot of it's going to get attracted to Chicago. So
so much of that,
huge issue.
As we tape this, these checks are going to be going out to workers any day now. I think beginning basically this week, people should start seeing some of that. That'll help in the short term, but it's only a financial Band-Aid. And the other thing is the ability of the federal government to keep throwing money at this problem is very limited. And that could be even a worse problem. That could be a financial hangover that would last, that could really undermine the stability of the dollar, the stability of the federal government. That's also a danger that we have to be cognizant of. We just, money doesn't grow on trees even for the federal government. And so with that said, I think we're going to be continuing to do updates. We talked to you last week. We're talking to you now. We'll probably be talking to you again in the near future.
Thank you, Terry.
But thank you again for joining us, and we'll see what everyone says, and we'll be in touch.
Last comment. I hope all this health news is good news. Hopefully, we're beyond the worst, and let's see where we go from here. But we continue to pray that things get better and better, and we get our economy going, and get the recovery for everybody going.
Yeah. We don't want to have people losing their life's work in their businesses. It's just not fair to them as well. So Ted, thank you so much, and viewers, thank you for watching. Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.